My name is Liseth Urias, and I've been a diabetic for 15 years, from the age of 17. I wasn't able to afford medication, so I stopped using it for about 5 years. My eyesight goes blurry and I see flashing lights throughout the edges. I did not know that diabetes would cause this type of damage to my eye. It would be nice to be able to see my family, my surroundings, especially my nieces and nephews. I'm sorry. I lose my energy a lot. Focusing through one eye, it drains me. So I feel like I'm not there for them as much. It's hard on me. I try to be the stronger one.
Liseth is a great example of our patient population. She's young and she didn't have access to care. We are a county-owned facility and our mission is to serve the underserved. She came in with diabetes that was out of control, high blood pressure. In addition, she was bleeding into her eye.
We had a surgical wait list that was hundreds of patients long, and to not be able to intervene in a timely fashion, and it was really, really difficult to deal with. Liseth and patients like Liseth would have to wait for months for surgery, and in the process were going blind.
Toyota was contacted by the Harvard UCLA Medical Center, and when I heard that many patients were going blind waiting to get service, I actually couldn't believe it. How can that happen in the United States?
People ask all the time, what on earth do making cars have to do with hospitals and healthcare? Hospitals and health systems are looking to the Toyota production system to improve, and we reached out to them. We really didn't know what was wrong. Sometimes when you work in chaos, you don't know how to get out of it. So what Toyota did for us is they helped us learn to see our own environment. And so we did observations. We stood in the clinic and watched the process flow.
We just had a table with all the charts lined up, one big mountain full of papers. Doctors were frustrated, nurses were frustrated. So with the color-coded system, now we know red is laser. Bam, here's your patient. It's so much easier for everyone.
Physicians were spending more time in the hallway than they were in the clinic. And the reason why is that they didn't have the supplies they needed close by. Now that sounds like a very simple solution, and it turned out to be. We asked them, what do you need at the clinic side?
Part of Toyota's message is that this is our hospital. They're not going to be here to tell us how to do things. They're going to come here and teach us how we can identify ways to make ourselves better.
It's changing our culture. It's transforming us as an organization. We're not the same organization we were a year ago. We're taking some of the lessons that we learned from the eye clinic and are spreading the change throughout the hospital.
Go and open both eyes for me, is that great? You did really, really well. Over the past 2 years, we've taken a surgical backlog that was hundreds of patients long, and we've eliminated it.
It's 5 o'clock, and all the patients have been seen.
This is the best project I have ever had. At work, we only do work. Here, we actually help people.
I never would have thought that implementing the Toyota production system would help save lives or keep people from going blind, but it has. Can you make out how many fingers I'm holding up?
It looks like one.
Very good. And here?
2.
Very good. Can you see the screen?
Looks like an F.
Very good. She was blind, at least in her left eye, she was blind. And what the surgery means is that she's going to have good vision for the remainder of her life, and she has many, many years ahead of her.
Being able to see my family